All right, welcome everyone. Thank you for joining us for our third and final part of this series of nurses telling their stories as part of this fellowship. We have three alumni fellows we're going to talk to you today. Very excited for you all to hear about them. First, we're going to have Mickey Meadows speak, and then it will be Eric Alfaro, finishing up with Lisa Jarek. Lisa, how you pronounce your last name? I'm so sorry.
Audiki.
Haraki. Thank you. And then we'll do some Q&A. We'll save the Q&A for the very end. And then that will be our run through for the day. Just to give you all a little bit more information about the fellowship itself. The fellowship came about in 2019 when two we'll call requests came in. The first request was from community-based organizations asking ANHE to send them some nurses to help them with some work that they were doing. And the second request was from some nurses who were like, I want to get involved with environmental justice work, but I don't know how. And so this fellowship program was created from merging those two requests. And we were able to launch the first cohort in 2019, where nurses were coming into communities to help them tackle serious environmental health issues with an emphasis on climate and health equity. And so there's a few components to this fellowship. The first is the project component, where nurses work in partnership with the community-based organization to address a community-identified environmental health concern, which we'll hear more about. Then there is another portion of the project where they participate in monthly webinars, where we bring in speakers who will speak to the nurses about issues of their interest. We have a survey they complete at the beginning of their process, where they can give out some ideas of what they want to learn more about. They receive mentorship from a more experienced nurse to help them develop their project with their community-based organization. And then in the latter half of the fellowship, they hold 2 educational sessions with other health professionals to share what they've learned with the greater public health field. And so with that, I am going to gladly stop talking and introduce our first speaker. Oh, forgot one other thing. Folks attend 2 convenings within the fellowship where folks will have an opportunity to build community, learn together, and expand partnerships. And so not only are they doing great work out in the field, but they get to come back and share their stories with their fellow fellows. And in this case today, with you all. And so starting with Mickey Meadows, who has been a nurse since 1993 and a pediatric nurse practitioner since 1998, when she earned her joint MSN and MPH from Yale University. She worked as a PNP in an outpatient clinic serving underserved immigrant and refugee families, and discovered her love of educating future generations of nurses as a faculty member at the Yale University School of Nursing. In 2001, Mickey narrowed her clinical focus and began working in the pediatric environmental health program, focusing on caring for children with asthma and lead poisoning. She earned her PhD in nursing in 2006 from the University of Connecticut. In 2016, she began working clinically in the school-based health center while continuing her faculty roles at the University of Connecticut. Quinnipiac University School of Nursing, and currently at New York University. Dr. Meadows Oliver has presented nationally and has written peer-reviewed publications related to environmental health issues that affect human health. And so, Mickey, I'll hand it over to you.
Okay. I will. Okay, so welcome everyone, and I'm just going to talk briefly about, hold on, let me start my timer too, because I can talk quite a bit. I'm just going to talk briefly about my fellowship experience and what led up to it, and then I guess we'll have questions and answers at the end. As Jeremiah said, I'm a pediatric nurse practitioner, and I worked in a, I'm just going to go back for 1 second. I worked in a children's environmental health program for about 14 years, and that's kind of what led to my interest here. So I started when my community-based organization was Project Access New Haven, and I'll talk a little bit more about how I got to that organization. And this is an organization whose mission is to increase access to medical care and service for underserved patients. And it was not my original, I guess, organization that I had planned on working with when I first started the fellowship. That organization was Connecticut Coalition for Environmental Justice, but the timing and what they needed just didn't work out. And so, we had a year, so it started to be a little bit of a panic. So I was like, well, I need to find an organization. And I knew someone who was running a nonprofit, and they were starting a program, not necessarily environmental based, but that would allow me to have an environmental focus for this fellowship. So I'll talk a little bit more about that. So the fellowship and what drew me to apply is, again, my clinical work. So I was very interested in environmental health at the time. Although my program mainly focused on two specific aspects, lead poisoning, which is huge in New Haven, and then asthma as well, especially in our underserved populations. The physician that was the attending for our environmental health program, he was a toxicologist. So we had actually kids from with other environmental conditions that came to our program, but really like the focus was lead poisoning and asthma and the environmental concerns around that. And when I heard about this fellowship, I realized that I wanted to really expand my knowledge about environmental health, because it had been strictly in children and strictly with lead poisoning and asthma, with a little bit of other stuff here and there, but those were like mainly what I focused on. So I felt like this fellowship would allow me to maybe see a wider population of people that was affected by environmental health issues. So for my time in the program, as I mentioned on the last slide, finding an organization and project that fit was actually a little bit tough because so Kara initially connected me with a person from Connecticut and Connecticut Coalition for Environmental Justice, but it just wasn't working out at the time, and time was ticking, and we were meeting with our mentor quite often. So I found an organization here in Connecticut that, again, did not have an environmental health focus, but did have they were starting a Me and My Baby program. And so I worked with my mentor to maybe find a project that would fit with that. So although I initially had a goal of working not with pediatrics with this program, I ended up doing a program that did involve children, which is my first love anyway. But this program, my mentor at the time, she was very into, I guess, organic food, organic farming, healthy eating, things like that. So we developed a program for this mother-baby program that taught them about, which foods, she called them the dirty dozen. So, which foods, how to make their own baby foods, how to determine which foods were safer for their babies to eat than others, all about healthy nutrition. So it wasn't the specific environmental health approach that I had initially planned, but, we talked a lot about sustainable foods and how to grow your own things. So from that aspect, I learned things, and so did the parents in the program. And then, as we all know, the pandemic hit. So the program, so I was able to really still do some education sessions with these parents and their children, or really they were infants. So really it was the parents that got most of the education. But as the pandemic hit in the middle of our fellowship, obviously we were not doing anything in person anymore. And then this was a pilot program, and it was not able to, at least on my community-based organizations, and complete, I guess, do all the deliverables that they wanted to have. And so it just wasn't picked up and funded again. So it just kind of went by the wayside. So it was nice to work with the families for that time, but the organization is still going, but that mother-baby program just didn't end up working out. So again, I feel like one of the hardest things to do was to find an organization and a project that fit within the time frame, because I felt like it was really a bit of a time crunch. And then again, my project, it changed over time, and that was fine because I was used to things like that, because I teach and I work in academia, and I've done a thesis and stuff, and things just have to change. It can be a little bit nerve-wracking though when you have timetables and really, I guess, I think I found something when I was going through my old documents. I had to do a progress report. So when you have to do a progress report and there's not much to talk about with your progress, it can be a little bit nerve-wracking. And I did also want to talk about just like working and being in the program, because I know that most people are going to be working their nursing jobs, so whether that's clinical, whether it's in academia. And so for the most part, during the time that I was in the fellowship program, I was in an academic position. So I feel like it provided me a lot more flexibility to meet when we needed to meet, for me to go to my community-based organization, for me to meet with my cohort of people and my group leader. So all of that was fine. And I don't know if I would have necessarily had that same flexibility in clinical. I mean, we probably would have worked around it, but we were all somewhat in the same area. Like New England is pretty small. Like I was in a New England cohort. So we were in Connecticut, Rhode Island, and Vermont. And so we were actually able to meet in person a few times, like just find a place. So that allowed me the freedom to do that. And again, like working with the parents and things like that, that was in the evening hours for my group. So that worked out as well. And because I only have a few more minutes left, I'm going to move on to what I sort of did after. So that 1 year, I really feel like was so helpful to me, because as Jeremiah mentioned, there's going to be monthly seminars. And we met with our cohort, at least a couple of times, like the whole big cohort a couple of times. So I got to hear what other people were doing. I was exposed to so many other environmental health concerns that I had not even considered thinking about. Like one of the women who was working with us, like she talked about things like wildfire. So that's back in like 2019 and 2020. And I hadn't thought about that then. And now we're hearing so much about it. And so it was great to meet that cohort of people. It was great to work with so many nurses that had the same interests as me. And right now, like I'm still involved with that community-based organization. So I'm a board member there now. So I think that was one big plus from that. So I made these lasting relationships. Again, I teach, so I'm in academia. So I helped develop an environmental health module for my, at the school I was at before, for the community health class. ANHE also sponsored a Health Equity and Anti-Racism Leadership Institute. So I was able to participate in the first cohort of that as well. So after this environmental health nurse fellowship, I participated in that Health Equity and Anti-Racism Leadership Institute. So I really feel like just being a part of this fellowship, again, provided me with so much networking that it has allowed me to do other things. And I feel like it also provided a little bit of legitimacy for me, because I was able to, I put it on everything that I do. And so I was, someone asked me, could I present at a conference? So I was able to present at a national conference on environmental equity. And then based on that presentation, someone asked me to write an article, which I haven't done yet, but it's in the works. It's due at the end of this month, so we'll see how that goes. And then someone asked me, even though I know a lot of these things are work, my husband always says, like, well, these honors that they give you are work. They are in a way, but it's like, I was asked to write 2 environmental health chapters for nursing textbooks. So I really feel like I was very proud of that. And then most recently, I was nominated to the Lead Exposure and Prevention Advisory Council of the CDC. We'll see what happens with that, but I was nominated by the AACN, and I was supported by my attending physician from my previous job. They said that the process takes 9 months to decide. I don't know, I guess that's the government for you, but it takes 9 months to decide who's going to be on the council. So I don't know yet if I've actually been accepted, but I really feel like having this experience as a fellow has just opened so many more doors for me. And I feel like it gives me like an air of legitimacy when people go and look for environmental health nurses to participate, again, either on panels or to write things or for committees. And I think that is my time. So I will cut it off here until we have our question and answer period. So that is it. And I'll stop sharing.
Thank you so much, Mickey. Can we show some love for Mickey in the chat? Or maybe some reactions? I completely forgot to note that this particular webinar is special in the sense that we're going to hear from some of the cohort 1 folks and cohort 2, which is awesome in the sense that we get to hear from folks who've been away from the program for a bit and what's happened. So board member, writing opportunities, speaking engagements. Awesome. fantastic news. Let's go ahead and jump into our next speaker, and I will share my screen. And also, folks are doing this, so thank you. If you have any questions about someone speaking, drop them in the chat, and when we get through the next two speakers, we'll go back and answer them. That way everyone has a chance to ask. But our next speaker is going to be Erica Alfaro, who is a public health nurse with the local county SF Bay Area NAHN chapter president and council member of the California Nurses for Environmental Health and Justice, and previous past president of the San Francisco Bilingual Toastmasters. Since Erica's involvement with the ANHE Fellowship in 2019-2020, she took the lessons she learned to heart, and since then has hosted webinars on the social determinants of health for farm worker populations and helped spread the word to other nurses and healthcare providers. She has worked alongside local nonprofits such as Safe Agriculture, Safe Schools, and the Center for Farm Worker Families. She's been an active participant in giving testimonies regarding the safety and harmful effects of human health at the Cal EPA, spoken at local news conferences on the dangers of pesticides, especially in low-income farm working communities, and the Watsonville and Salinas communities. She's written an op-ed to bring awareness on the harmful effects of tolone, a common fumigant used in strawberry and grape fields, and how the safety standards recommended for farm workers are not adequate. From her participation in the fellowship, she has made wonderful connections with community members and has focused on amplifying work done by nonprofits to educate and mobilize nurses. Her work uplifts the environmental justice work that has been done for decades by the many people working jobs in the field and those that are affected on a daily basis by inequities. As a nurse of color and proud Mexican immigrant, she aims to support others and work towards better systems that will benefit the health and well-being of those who put food on our tables. She continues to stay connected with her CBO from the fellowship and is a founding council member of Cal NEHJ, which I would love to hear what that stands for. And she is the 2023 recipient of the National Association of Hispanic Nurses Sarah Gomez Elric Humanitarian Award for her work advocating for farm workers. So take it away, Erica. Looking forward to hearing what you have to share.
Thank you, Jeremiah. I had forgotten that I had that lengthy intro. But actually kind of to build on some of the things that Mickey had mentioned, right? It's that there is an understanding that there's something really important when it comes to environmental items that relate to health. Prior to this fellowship, I'd been a vegetarian for 15 years. I carry around my own water bottle. I mean, my utensils. I mean, I'm an outdoor enthusiast, you name it, a community service person, right? And for me, this fellowship was no big brainer. Like, this was the next thing to do, because I knew that there was just so much that I didn't know when it came to environmental health, and just essentially to get some of that language that sometimes we know exists but don't often have. And so as a public health nurse, who was extremely active at that point in time with my Toastmasters organization, I'd been a non-member, and non being the National Association of Hispanic Nurses, I knew that this was a very important fellowship to essentially to be able to help me understand more when it comes to engaging with my community. Similar to our previous speaker, right? A lot of things changed, and the CPO, or the community-based organization I was supposed to be working with, didn't work out. And so for those of you who are here who are going to be part of that, or who have something in mind, flexibility is really important. Some of the things that Jeremiah mentioned are pretty much post my ANHE work. So for the last 2 years, I've been able to build those relationships that I essentially wasn't able to build during my first year of the fellowship. When it came to the fellowship itself, I remember taking on an assessment perspective, understanding that like perhaps my organization wasn't gonna work out at the beginning, right? I started outreaching to within my county to see what climate plans there were within my system. I started reaching out to other organizations to see what was happening or what kind of understanding we had of climate change, environmental health issues. And so I want to say that during my fellowship, I did a lot of research. I looked at pretty much just what was available and what was available within my realm, my circles, my circle of friends, my circle of community and work, essentially, right? I also did the health equity and anti-racism training as well, understanding that besides the environmental health component, right, there's a lot of systemic racism and environmental racism as well that is intertwined. And so that was what was so wonderful with this fellowship in particular, because again, right, we often understand that there's something wrong, but when we're given the language, it's definitely that much more powerful. And for that, I love ANHE and I love the work that has continued to be done, just because now that I have found essentially my community-based organization, or as I should say, community-based organizations, because I am working with Safe Ag Safe Schools and Family for Farm Worker Family for, oh my gosh, I'm blanking out on this, on my my other organization. They would kill me if I didn't say it correctly right now, but that's okay. But point being is, if the beauty is that the work is really ongoing, and understanding that this is really just a foundation. And obviously, if you do have a project already in mind, if you do have a nonprofit that you're going to be working with, it's wonderful, but understanding that this is just going to build upon that. And that was what I honestly took out of that, and understanding that as nurses, there is a really high impact that we are able to make within our community. And it's so beautiful to work with an organization that wants to work with me back, right? And that I'm able to have that relationship, that trusted relationship with my community. And so that's one of the beautiful things that I took out of this wonderful fellowship, was that it essentially, right, the work builds, the information is ever growing, and the partnerships are ever growing. Out of this fellowship, I also was able to help with the California Nurses for Environmental Health and Justice, which is very much focused on exactly those same missions, and being able to host seminars and workshops as well. Within California, as we know, different states have different laws, so that has been wonderful, and to build that community within California has been something that's been very, very wonderful. I don't know how much time I have left, but again, I leave with I want you to leave with a couple of things, right? It's just that the work is essentially ongoing. This is a great foundation for where you're hopefully going to go, and relationships that you're going to build. And yeah, I'm excited for everybody who's here, and I'm excited for our speakers, and just to be able to share some of that knowledge. And yeah, that we'll take questions at the end of our sessions here. Thank you.
Thank you, Erica. Let's show Erica some love in the chat as well. Or if you have knowledge and skill of the reactions in Zoom, you can throw some reactions up. Either works. And then I will have the distinguished pleasure of welcoming our final speaker before we jump into the Q&A section. And just as a point of reference, Erica was also part of cohort 1, who had the honor of launching in the middle of the pandemic. And so there was a lot of change, accommodation that had to occur within that cohort. But as a pilot, they did a wonderful job in terms of setting up cohort 2 to be able to operate in a virtual hybrid setting. So thank you to both Erica and Mika for that. And I will go ahead and introduce our final speaker. Lisa Harege is a clinical assistant professor in the Edson College of Nursing and Health Innovation at Arizona State University. She obtained a Bachelor of Science in Nursing degree from Grand Canyon University and a Doctor of Philosophy in Nursing from the University of San Diego. She's been a nurse for 32 years and a nurse educator for 21 years. Her background is in pediatrics, community health, and school health. Lisa has completed various articles, textbook chapters, and online learning resource chapters regarding community health, public health, integrative health, health promotion, school nursing, evidence-based practice, and political activism. She is a fellow at the University of Arizona's Integrative Nurse Faculty Fellowship and completed the fellowship in 2018. She holds certification as a nurse educator and is a certified choral mindfulness teacher. Go ahead and take it away, Lisa. And if you're talking, you're on mute. You're still on mute. So I think maybe
There we go. How about that?
Woo!
Righty. Well, thanks. Thank you for that introduction. And I'm going to share, let me put my timer on here, about my experience with the fellowship. All right. Okay. So the project title was Climate Change Education, a Scientific and Faith-Based Perspective. So I'm just starting with the title that, of course, I looked at the scientific, and my CBO was a faith-based organization. So that was important to include in my content. My community-based organization was Bourgade Catholic High School, and they have about 450 students. It fluctuates. A minority is the majority of the population, and then they are a lower income high school with lots of scholarship-based students. So I started, let me go back here. Sorry about that. Okay. Okay. I wanted to talk a little bit, I skipped a slide for some reason, about my journey. Okay, my journey through this experience. And I kind of put each one because it was quite a ride. And I want to talk a little bit about each of those stops that I made in my journey so that we can all realize that no matter what journey you take, you're going to end up at the right place. First of all, we had a Zoom start, which it was kind of the end of the, towards the end of the epidemic. And so that was wonderful. We were all able to meet from our own spot, and it was an excellent opportunity. So even though it was Zoom, it was just really good. We met with our mentor throughout the program. We had meetings with our mentor, and we started off pretty strong with my mentor. But as you can see, that third bullet, I had a pretty significant family emergency. And then my mentor too had some other situations where our times couldn't meet as we would like, but that did not hinder anything at all. Kara was available. Jeremiah was very instrumental in keeping me on the train tracks. The monthly Zooms were awesome, part of my journey and learning more about environmental issues and education and people, literature, science. It was just wonderful. along with my emergency, the inability to attend a few of those Zooms, did not hinder this experience at all, because I was provided those recordings and did not miss a beat, even though I was in another place when those were being offered. First idea, second idea, third time's a charm, right? So my first idea was an organization or a concept of blue zones. And where I work at ASU, I was on a committee. I thought, oh my gosh, this would be perfect. It did not work out at all. And I got schooled by Jeremiah. He met with me. He does our check-ins, and he asked me some certain questions about this. And he's like, well, that probably isn't the, you might do someplace else that's not for profit of those natures. And then attending those blue zone meetings, it wasn't community driven. I was very, it didn't seem community driven. So anyway, second idea, elementary, met with them, worked it out. They never contacted me back after our plan was on rolling forward. So third time's a charm. 10 months within the program, I finally got a good, strong CBO. And then I went to the final conference in Minnesota. Then I implemented my project. So I wanted to make sure that I put that there, that I had it all solidified, but I still didn't implement it till the end. That's my a title there. I jumped ahead, my community-based organization. And this is some of my work, a teaching plan. Whenever I teach, I do some of the background work, and this is a lot of words, just an example, but I put the framework for science education that guided my work. Climate literacy at the bottom of this table guided my work. And those resources I got from ANHE. So ANHE has a website and really good, credible sources for us to use. Now, I couldn't just use all those resources and teach that at Bourgate Catholic because they're faith-based. So I had to make sure that I put some faith-based tenets in it in order to make it what the community, the culture of the community. Again, my teaching plan, this is one example of an objective that I made. By the end of the presentation, students will define climate change. Was as simple as that for part of the lecture. And then on the content that I taught, my strategies that I utilized, we had a video, a PowerPoint, and lots of discussion. And then my evaluation piece. So I had about 3 of these on my teaching plan. I think 4, because the 4th one was the Catholic teaching and the Catholic perspective on climate change, which was important to include. This is the poster that I presented at the final presentation, and it's a lot bigger. And my PowerPoint that I presented to my students was based on this poster. So I have this here for anybody to look at, but I do want to highlight my blue boxes under student learning outcomes or objectives. So I had 5 objectives that I wanted the students to grasp. And those were define climate change. The second one is discuss the causes of climate change. The third is describe the health effects of climate change on people and the earth. 4, determine strategies to address climate change. And then lastly, explore the Catholic Church's teachings on climate change. So the Pope had like 174-page encyclical on it, and it was really refreshing that he definitely thinks it's a priority. It needs to be a priority. So it was kind of cool to hear that. From this teaching project that I did as a guest speaker, students, one of the strategies I utilized is they were to develop a Instagram page or a TikTok about a climate change issue. So just one page. I kind of had a contest. The most humorous page you can post, the most simple, the most scientific. So they had some categories, and they were able to share those with me. And so they could post it on their Instagram or their TikTok and reach more friends through that. And I hope to present that work. I got permission at a conference. And I had another idea from a colleague, is have the students go out and take pictures, use photography in their world that address climate change or climate justice principles. And then they can bring that back and share it. And it just has them keep their eye open and tuned into that idea. Okay, I've got 2 more minutes, so I think I'm doing good. The next process, like what's next after this wonderful fellowship, I'm going to continue with the presentations each semester. Like I said, I'm going to apply an abstract for the WIN conference, which is October 15th. So I'm going to take this idea, this work, and the outputs, the outcomes of those pages. And also they were to order trees for shade for the campus. And I'm not sure if they followed through with that. Connection and work with other ANHE members. So I'm working with another ANHE member. It's on a different project, but we connected as school nurses. And I developed a health professionals course at Borgate Catholic High School. So this is a full year-long health professions course, but I was able to, I asked them if I can input on health professions who address environmental health and include that content in that course. I joined the ANHE Climate Change and Health Work Group, which was new just about 3 months ago. And then also Dr. Azita Amiri contacted ANHE to find a nurse who does health education. And I was connected with her, which is wonderful. She's applying for a grant application and I'm working on there. I submitted my template that I used for Borgate Catholic, but I took out the religious components and added more secular components to that. And I will also, if her grant gets accepted, oversee their Saturday modules and their senior mentoring programs. So would I do this again in a heartbeat? I would do it again. I have more knowledge, more passion about the topic, more opportunities have developed. And at the end of the day, so much more growth as a better human being, steward of the environment, a better nurse. And yeah, so thank you. That's it.
Thank you, Lisa. Right on time, too. Let's show some love for Lisa in the chat and with the reactions. That was wonderful. And this is my favorite part of these webinars, just jumping into these questions. So I'm going to check the chat right now. And we're going to scroll down. And as we're going, if you have any other questions people are answering, feel free to add them in there. The first 2 questions are from Sally. And the first one is, oh wait, no, I think it's to Ann in Philly. Where do you teach in Philly? I think that might have been already answered, maybe. We'll go to the next question. Mickey, the question is, wondering if you worked with WIC at all on healthy foods.
So not as part of this project, I didn't work with WIC. Just in general in my life as a pediatric nurse practitioner, I've worked with WIC for years and years, just because also a component of our treatment of children with elevated lead levels is a nutrition component. And where I worked, almost everyone that came to our lead poisoning prevention clinic was from an underserved, low income area. So they pretty much all qualified for WIC. And our WIC program, maybe others too, like had a nutritionist there on site. So we worked closely with the WIC nutritionist to try and help families plan meals and plan snacks that were high in iron, high in calcium to help go along with our lead poisoning treatment plan. But so again, not specifically as part of this ANHE project, but in general, especially with my lead poisoning prevention work, I worked with WIC.
Awesome. Great question. Our next question comes from Anna Cornell, which is just asking Annie about whether there's a repository of work from the projects conducted by the numerous fellows. And we actually worked to create a website to store as much of that information as possible from cohorts 1 and cohorts 2. And so Kara linked the link in the chat, but I'll drop it in here again for those who would like to check the website out for more information about the other projects that folks have worked on. I'll also add that that website will hopefully be updated more and more. We're going to have these recordings added to the website hopefully sometime in the next couple of weeks. And then as the cohort 3 projects go on, we'll be able to update more again from there. So the more we do, the more will show up on that website. Let's see the next question. Scroll. Another question from Anna. It says, this one's to you, Lisa. What was your aim and goal with the Blue Zones? I am intrigued by the Blue Zones, so just curious.
Yes. So with the Blue Zones, ASU was working with the community in the south part of our Phoenix metropolitan area that has some more health disparities, lower life expectancy. And so the Blue Zones does have a lot of good ideas and principles. And so when I joined the committee, they were sharing with us some next steps on starting to implement the program. And I think that I've learned more about them. Something just didn't sit right in my gut after attending some of the meetings, and it's kind of hard to identify. But my thought process is that when we change or do work within a community, it has to come from within that community. And I just kind of felt that Blue Zones was coming with their ideas and just putting them down on into that community. And Hispanics did the foods match, did all their interventions and principles. What is it? Culturally appropriate. So I think that's kind of where I felt with the Blue Zones. Yeah. I hope that answered your question.
And I'll also jump in and just say, it's not that the work of the Blue Zones, is not positive. It's just that, let's say they come in and say, we want to do this, but the community is being like, we want to organize and close this incinerator that is causing poor pollution, poor air, and giving folks asthma. Well, if someone comes in with a lot of money, they can drive where the focus is going to go rather than keeping the focus where the community is saying is important. And that's and that was kind of the conversation that Lisa and I had, being like, wait, who's really at the wheel here? And do we think on a moral level that they should be, given that the people don't necessarily live in the community that they're making decisions for?
And from that education from Jeremiah, it's just wonderful how other disciplines or people such as Jeremiah can inform our nursing practice. So thank you for that, Jeremiah. So that when I would go to those meetings, I took those questions he asked or put in my head, and I listened for answers or data that showed me that it is community driven, it is culturally appropriate.
There's a lot of really, really appreciative, positive comments in here. So to all the speakers, I hope you take a moment to read through here. But I don't see any other questions. Do folks have any more questions for our presenters? I do have a question, and this is just more of a clarification question for you, Erica. You mentioned that you were still working with your group and that you had difficulty in getting your project started. I wanted to know, in the case of Lisa, it took 10 months to start their project. How long did it take to start your project? And what would you say to someone who's perhaps worried about how long it's taken them to start a project?
Yeah, well, I would say that I didn't have a project completed, honestly. did I feel like I didn't deliver? Yeah, there were definitely feelings of like, oh, I didn't complete a project. I had done a lot of research. I'd done a lot of, made a lot of connections, but similar to what Lisa had mentioned, when we are going to a nonprofit, right, we have certain goals and things that we have in mind that we may want to do, but at the end of the day, a true partnership is something that's driven by both parties, right? And ideally, you really do want to have the community-based organization, I don't want to say lead, but really respect the values and the things that they need, right? And we, the way that I saw how I was going to approach this was a partnership with somebody as to how I can support, and not necessarily, because I had all these ideas that I wanted to do. I had, educational things that I wanted to teach young kids as well, and young teen moms, and realizing that, that there were a lot of barriers in the first place, and there were some things that weren't going to necessarily connect. And yeah, so I want to say that I didn't have, and obviously, like Jeremiah mentioned, we also were in the middle of a pandemic, so then it was just kind of hard to push when a lot of focus for a lot of, at least my community, was to stay sane, to have appropriate access to mental health services, to stay healthy, to learn how to grieve, because a lot of us had known someone who died from COVID, right? And so I was not going to try to push my agenda when I saw that there was just so much going on, which is now, again, 2-3 years later. So, right. It's really nice to say, like, oh, well, now I've been part of a community-based organization for the last 2 years, right? And with that, have been able to collaborate with other similar organizations in terms of pesticide use and some of the environmental issues that come about with that. And again, focusing completely on what my CBO needs are, and me as a nurse, public health person to be able to support that. I hope that answers your question, Jeremiah.
That answers it perfectly. Thank you. I just wanted to make sure that folks have an understanding that if you're in cohort 3 or going to be a part of this program, that your project doesn't have to finish in a year. Like, odds are this community-based organization you're working with has been working on that issue for years. And so you flying in for 12 months is not going to solve, quote unquote, any major thing immediately. The point is to show up and support however you can and push the progress that they've been pushing for years, sometimes even decades, along, and then learn from that experience. At least I see your hands up.
Yeah, for the new cohort members or people who are considering the future, what was that analogy you used, Jeremiah, with the ship or a boat? Remember that analogy? To make a project sustainable.
Oh, you want to make it so that when you finish your voyage, like, the boat doesn't just like sit, like someone else can get on the boat and take it off. The boat can continue going. I think a lot of times people will think of a project, and then as soon as they finish their project, like, the boat is unusable because it was powered by a person rather than powered by the community itself. And this is why I think it's really great to jump on board of something that's already happening. The boat's already in sail, and you jump in. Now you're the chef on the boat, and you're feeding everybody, or you're the navigator. Like, you don't have to worry about being the end all be all, and you don't have to worry about, like, if I'm not here, who's going to move? It's cool. This is what it means to work and be in community. Thanks for that reminder. And Anna, I see you have a question. How have you been able to grow your connections with CBOs and scale your projects? This goes to anyone.
Well, I'll just say, go ahead, Erica.
Mickey, you want to go first?
Oh, well, I was going to say that I was involved with my organization, but I haven't been able to scale the project just because of funding. It got, that mother baby part got cut back, but I was, you know, I'm on the board now of the organization. They don't have an environmental health focus currently, because they're navigating patients for different conditions, but it's nice to still be involved with that nonprofit. Sorry, go ahead, Erica.
Yeah, I would say this is right now, for me at least, this is a work in progress. Right now I am working to essentially, I don't want to say create other Ericas, understanding that I only have limited capacity, right? I work full time. I'm president of a nonprofit. I'm really, really busy. And so I'm really trying to start getting others comfortable to do the same. I'm bringing someone along. I'm mentoring someone else who's expressed interest in the work that I'm doing. I'm willing to share and kind of, and definitely not over imposing, right? Like people really want to be able to learn, but definitely sharing the experiences so that the work in the community is, like Jeremiah mentioned, right? The work continues and the boat carries on, right? We're continuing in motion. So for me, it's just been being really patient and yeah, just trying to figure out ways to find, I don't want to say find your tribe, but essentially find your people. Like I mentioned, I was able to help with starting California Nurses for Environmental Health and Justice, understanding that ANHE is also here nationally for all of us as well. So definitely, yeah, just little by little. And then Lisa, I don't know if you have anything else to add.
Yeah, no, I think regarding connecting with the CBO, lots of phone calls, you know, meetings, you know, listening to see, are they open to ideas or pitching ideas and saying, does this fit what you need? But lots of phone calls, emails, and several meetings. Yeah. It's like fishing, lots of fishing, and then we get a good bite.
And I want to add too, the work of cohort 1 and cohort 2 will make the work of cohort 3 a lot lighter, because the more folks see what has been done and what's possible, the more excited folks will be about possible partnership. For instance, there's a few organizations in some of the cities where some cohort 3 nurses are that have asked for a nurse because they had heard about the program and were like, we would love a nurse fellow to help us on this project. And so once that starts to become more common knowledge, I have a feeling that the whole process will be a lot easier for all nurses coming into this program. Oh, great question. How did you all balance this project with your nursing jobs, home life, etc.?
Yeah, this is Lisa. I really think that the way the fellowship is run, where there is recordings, there are many opportunities, there's check-ins with your mentor, with Jeremiah, that really helps, that really helped me decrease my anxiety and let me move forward. Because sometimes if it's overwhelming or I don't know, it's hard to move forward. Regarding work, I always try to kill two birds with one stone, so to say. So if there's something I can do at work and tie this ANHE work together, I definitely do try to do that, because I have a scholarship and service requirement for work. And so my scholarship and service is my ANHE work that I've done. So that's how I've tried to do it, combine the two birds. Maybe if you're in the hospital setting, joining a committee that is related to environmental issues, and then you might be able to do some ANHE work within that perspective. So those are just some ideas. And family, yeah, my kiddos are all adults, so it's a little bit easier there. But the emergency did happen, which was family oriented, and like I said, they were so understanding. I completed after, but I did complete it, but it's really not complete, my project. It's continuing now. It's like a flower that budded, you know, it's still growing, still growing.
And I just wanted to add on about that, you know, I don't know how it all goes with this newer cohort, but, you know, we had the dates for a lot of things well in advance. So I was just able to plan around some things. So I didn't really feel like it was a burden because I was able to plan ahead for, you know, because when we initially started, it was 2019. So before the pandemic, so we knew we were going to have a weekend retreat somewhere. So I planned for that. We knew we were going to have these monthly webinars. So it's like I planned my time around that. I know it can be certainly harder with clinical work than with academic work, but I do feel like maybe with enough planning, you can kind of get around some of the things that might, again, cause you stress about can you attend or versus not.
Yeah, I echo what Mickey said. And yeah, just having a really good planner, and by planner I mean just writing things down. And yeah, just helping with time management. And I am gonna say something, something has to give, right? There's only a certain amount of hours we have in a day. And yeah, sometimes our personal health. I mean, I think I may have gained a couple of pounds, but this is probably pandemic weight as well. But again, it's just, you know, just trying to plan ahead and try to just take it one day at a time. And honestly, the best advice that was ever given to me was, was to take care of myself first, so that I am able to take care and or help and support my community, right? And so that's the advice I give to all of you future cohort 3 is make sure that you allot some time for self-care and for eating enough good foods, for resting. That would be my advice.
I think we're approaching time, so just wanted to say thank you to Lisa, Erica, and Mickey. Wonderful presentations. Thank you to everyone who's come in and listened and asked questions. We appreciate your participation. We will make this recording available for the folks who came in late, so keep an eye out for your emails. And I believe, Kara, you want to say something about the continuing education credits?
Yep. So everyone who registered, we are offering one continuing education nursing CE, and pay attention to your email. When we send out the recording, we'll also have a post test and evaluation that you'll have to complete if you would like to receive CEs.
And on that note, we will let everyone go. Thank you so much for coming. We'll be in touch about any other future opportunities with ANHE, and take care.